Now we move over to our third and last speaker, Dr. Muhammad Tahir. He is a highly experienced healthcare professional with over 2 decades of experience as a practitioner pharmacist and a hospital management expert. He holds an MPhil and PhD in pharmacy practice, an executive MBA from LUMS, and has received training from prestigious institutions like Utrecht University, Netherlands, and Singapore Management University. He has published numerous articles in pharmacy and medical journals and has led pharmacy projects, including the development of pharmacy clinical decision modules. He is currently the COO, Chief Operating Officer at Shaukat Khanum Memorial Cancer Hospital and Research Center, Lahore, having previously held senior leadership roles at their Lahore and Peshawar campus. Without any further delay, I would warmly welcome Dr. Muhammad Tahir to please proceed.
Okay, thank you. First of all, I would like to thank you, Rashid Mustaq Saab. I have no idea, I haven't met Rashid, but he contacted me through some social media. So I am greatly appreciated and thank you, Rashid. Assalamu alaikum to all of you, specifically Jamshed Saab. I know Jamshed very well. Assalamu alaikum, Saad Kazmi Saab. So I will take the start with very simple, why we are here. Again, Rashid have given some idea, but I will talk hardly a few minutes regarding the current theme, what we are doing right now, why we are gathering here. So obviously, we have very well good idea. The theme for World Pharmacist Day of this year is to think health and think pharmacist. Now, this theme basically highlights the essential role of pharmacist in providing accessible or safe and effective healthcare. And it calls for greater recognition and investment in the pharmacy profession so that we can strengthen the global health system. So I would like to spend a few minutes what exactly the theme or the key aspects of the theme of this year. So I feel this theme is actually talks about firstly the public health role. The theme emphasizes basically that the farms are the key players in safeguarding public health and ensuring better patient outcomes. So I believe we as a pharmacist to have to review how can we improve the quality of patient life in terms of medication therapy. And whenever we are talks about public health, that's mostly talk about more preventive approach or proactive approach rather than reactive. Second, I feel the key aspects I think is expertise. I feel it acknowledges pharmacists as a trusted health advisor who provide expert advice, and he is the main key role which promote medication safety and can guide very effectively patients in managing their health or in managing their problems in related to drugs. Third thing I feel whenever we talk about think health or globally, we have to look at the accessible healthcare. So whenever you are saying the think health, think pharmacist, it always encourages everyone to recognize pharmacists as a crucial link to health, knowledge, and services. This year we bind health with the pharmacist. So pharmacist is the integral, the key, crucial part of the healthcare system. Then another one area I feel is, this is my understanding and this is my perception, it's actually a call for some investment. The theme also serves as a call to action for policymakers basically, so that they can invest in the training of the pharmacists, so that they can improve the robust pharmacy services, so that they can ensure the quality, they can ensure the safety, or obviously they can improve the efficiency in care related to medication therapy. And lastly, I believe another one aspect is the sustainable health system. What is sustainable health system? I remember one of the federation, fifth federation, and according to the Federal International Federation of Pharmaceuticals, what they feel, the champion of this theme is to basically to underscore the vital contributions of pharmacists basically to build strong and sustainable health system worldwide. So pharmacist basically is an integral part of all, the triangle of the healthcare system. So whenever we are talking about any healthcare system, we can't think about without a pharmacist. So pharmacist basically is a highly reliable, highly safe final check. Whenever we are saying a final check of any system, it means he is the final check of all processes related to medication therapy. So this is a very brief introduction, what I believe as a clinical pharmacist, or with reference to, you can say, basically the theme, actually what exactly is saying. Now, looking toward as a clinical hospital pharmacist, obviously I'm also working in the leadership role. There are certain challenges, obviously, we are facing. I would like to share a few of them because I feel this is important to highlight in this forum so that we can think about how gonna we improve the pharmaceutical services. And especially, obviously, I'm in Pakistan, so I will talk about mostly with the Pakistan related challenges. So number one, I feel one of the major challenges I am facing is the acute shortage of pharmacists, the skilled pharmacists. Uh, Still, there is a major barrier. We are facing a severe shortage of qualified pharmacists within the hospital and specifically, I believe, in the public sector. I recommend that we have to review because the recommended ratio is different, but overly generally we can say one pharmacist per 50 beds. And there are certain data is saying if you are giving some critical care services, so obviously you need one pharmacist for 30 bed, or if you are giving to some specialized services, the pharmacist ratio or the bed is going down, or sometimes it may be 20 bed per pharmacist, but generally is a one pharmacist per bed. But if you have to look at our public hospital, unfortunately, they have hardly one pharmacist for 1,200 beds or 1,500 beds. So this is where we have to look at, I feel, within the diaspora of Pakistan. Secondly, I believe is the lack of recognition and integration. Pharmacists are still not widely accepted as an integral part of healthcare team within Pakistan. Still, we are striving, but many healthcare professions, I believe, like Shaukat Khanam, we have in this, we have Khan University, and they have an excellent pharmacist role. They have playing and they have putting all effort and they all recognize. But still, I'm talking about in the large scenario. So this lack of recognition basically leads pharmacists to being underutilized and not involved in the key decisions, specifically in the public hospital. Like, for example, they don't have any PNTCs. If they have, so they are not actually, supporting or contributing with that. Then obviously we have very limited clinical roles. Again, even then after earning PharmD curricula within the pharmacy, within the Pakistan, I remember it started since 2003. But unfortunately, we are still largely confined to traditional roles of record keeping, procurement, and simple dispensing. So they often have limited opportunities to engage in patient-facing clinical activities. So I believe I will request for all policymakers to look at this. Uh, Another one challenge I feel is underemployment, and again, so many people maybe disagree the migration. Obviously, we have a large number of PharmD graduates each year. I feel a significant portion remain unemployed or maybe underemployed, number one. And this leads basically a brain drain with many qualified pharmacists seeking opportunities abroad, where this is a more valued and obviously better compensated. So I don't know how gonna we deal this, but this is a very alarming situation. And I feel this is not only for the pharmacists, I have seen in the nurses as well as the doctor level, but I think as a policy maker, we have to think about, look at this. Furthermore, I feel quickly curricula development, there are some training gaps. I feel while PharmD program is an improvement, I believe, but some still criticizes that curriculum for not being sufficiently practical, or you can say clinically oriented. But the good news is that I have seen newly revised curricula, and I am very happy. This is at par, and they have given a very good opportunity for all clinical pharmacists to excel, to get trained within the clinical setting. So I believe this curricula now, if we enforce with true spirit, will improve the clinical knowledge or clinical skills of all pharmacists. So in the last simple, I would like to say a few words as a message. I believe that all pharmacists, please remember, you are at heart of patient care. Please remember, your expertise and dedication are not just about dispensing medicine. Please remember, they are about ensuring safety, you can say preventing harm, and obviously, you are playing a very good optimizing health come out. So every day you are the final checkpoint. As earlier said, you are the final checkpoint, the medication expert and the patient advocate. So you may have to improve. You have to improve your knowledge. Please try to improve your knowledge. Try to improve your learning skill. This is very important. Your vigilance basically makes a difference. Your knowledge will save the lives of the patient. So you are an indispensable part of the healthcare team. So please keep up the life-saving work and good luck to all of you. Thank you, Rashid. Thank you very much.
Thank you so much, Dr. Tahir. It's a great pleasure and honor to have you in this insightful session. And so what I understood from your talk, so the key takeaways and the challenges are four. There is a shortage of pharmacists in the country. Then the second is the lack of their recognition. And the third was the unemployment, and it is resulting in the brain drain. And the fourth one was the curriculum development. And you are very right. The pharmacist is the final checkpoint before the medication is dispensed to the patient.
Yeah.
So